Have you ever run through a tough case in your head before entering the operating room? You are running scenarios the night before or mentally rehearsing while hand washing. If so, you are already tapping into one of the powerful tools for improving surgical performance, cognitive simulation. Today I want to share how this simple mental skill, when applied correctly, can significantly enhance your learning of surgical procedures and overall surgical performance. I'm Dr. Uttam Shiralkar, a surgeon, psychiatrist, and a surgical coach based in the UK. And you're watching a channel dedicated to surgical excellence. Traditional surgical training follows what is called as apprenticeship model. See one, do one, teach one. However, in this day and age, in 2025, surgical trainees across the world face fewer opportunities for hands-on practice due to various reasons like reduced operative exposure, the increasing complexity of procedures, and heightened patient awareness. What if there is a way to safely rehearse surgeries anytime, anywhere, without a scalpel, without a patient, and without expensive simulation lab? That's where cognitive simulation comes in. Cognitive simulation is a method of structured mental rehearsal. It is a deliberate practice by imagining a surgical procedure in as much details as possible, step by step, moment by moment, with consideration of potential complications. Although it is not that popular in surgery, many other professionals use it, but with different names. Athletes call it visualization, pilots call it chair flying. But for surgeons, it is surgical cognitive simulation, an art of running the operation in your mind before you step into the operating theater. I just want to clarify here that cognitive simulation isn't just vague daydreaming. It is structured, focused, and disciplined. If done correctly, your brain activates the same neural circuits that fire when you are physically performing the surgery. Effectively, that strengthens muscle memory pathways without touching a patient. Just imagine, you're closing your eyes, running through every single motion of your next case. How you hold the instruments, when you make the critical move, what you will be doing if something unpredictable pops up. You can feel the tension, the sounds, the rhythm of the procedure. You may be wondering, does it actually work? There are various studies in different specialties that shows it works. Studies done in laparoscopic and orthoscopic surgery confirm surgeons who practice procedure mentally perform better and faster than those who didn't. They made fewer errors, required less supervision, and reached competency earlier. We conducted a study published in the British Journal of Surgery that showed trainees using cognitive simulation significantly shortened their learning curve compared to those received the traditional training alone. We showed that surgical cognitive simulation strengthens procedural memory, it enhances anticipation of complication, builds confidence, and reduces stress of surgeons. You may know that surgical learning curve shows a rapid ascent from novice to proficiency. Without structured practice, it may require dozens or even hundreds of cases to achieve competence. Cognitive simulation accelerates that curve. Here is how. 1. Structured recall. You rehearse each step so that the sequence is hardwired before you enter into the operating room. 2. Error anticipation. By mentally rehearsing what-if scenarios like sudden bleeding, you are primed for rapid decision-making under pressure. 3. repetition without risk. You can run through the complex operation 50 times, 100 times in your mind before the first real patient. And last, cognitive bandwidth. Fewer mental resources are spent recalling what is going to happen next. That leaves more bandwidth to handle unexpected events. We all remember that the first challenging procedure we performed in the early days of our surgical training. The nerves, the uncertainty. But what if, before you ever touched a patient, you had already practiced the whole case step by step 50 times in your head? That's what cognitive simulation does. You lock in the key steps before you walk in. You brainstorms the what if. So, surprises don't throw you off. You rehearse complicated moments until your response get automatic. In video game language, it's like a cheat code or a shortcut for developing surgical skills. So how do you practice this? Here is an overview, step-by-step method you can start using today. I will explain the details in the following videos. So these steps are just for you to get started. First, choose a procedure. Select a case you're preparing for, like a laparoscopic appendicectomy. Second, create a quiet space. Sit comfortably, close your eyes and remove distractions. Third, run through the stages. Visualize everything, scrubbing in, patient's positioning, trocar placement, exposure, dissection, controlling key structures, and closure. 4. Add sensory details. This is the most important step. Hear the sounds, feel the texture, anticipate resistance of tissue planes. The richer this imagery, the stronger the effect. 5th, build in complications. Imagine a bleed. Imagine equipment failure. Walk through how you would respond. 6th, repeat regularly. Just like physical training, consistency creates mastery. Start with once a day for 5 to 10 minutes. And if you want to get fancy, record yourself talking through the steps or a dry run with another trainee. You will start to notice real improvement, quicker recall, more creative problem solving, and way more confidence. I know many surgeons who run a mental dry run every night before a big surgery. Others go through rare trauma scenarios in their head, so they aren't blindsided when stuff gets intense. The best part? You will see the performance get sharper, sometimes after just a few sessions. Many top surgeons already use this technique. I know one cardiac surgeon who mentally rehearsed every clamp, suture, and graft the evening before surgery. There is one orthopedic surgeon who visualized a total hip replacement before stepping into the operating room, and he experienced performing faster and more confidently on day 1. I remember a trauma surgeon for preparing a rare but catastrophic scenarios like damage control surgery in unstable patient. He used to use this technique. So he says that he used to be ready when the crisis hit. One more thing. Cognitive simulation isn't just about speed or performance. It is about safety and mindset. It improves confidence in inexperienced surgeons. It reduces preoperative anxiety, which sometimes is present in surgeons when there is a complicated or unfamiliar case. It creates a sense of control even in unpredictable cases. When you have already done a procedure 20 times in your head, the real operating room environment feels familiar and not overwhelming. So the conclusion? Cognitive simulation is one of the simplest, cheapest, and yet most powerful tools to accelerate surgical learning. It can transform your preparation, sharpen your performance, and ultimately shorten the steep climb of the surgical learning curve. As surgeons, we train our hands relentlessly, but the future of surgical mastery comes not just from training the hands, but from training the minds. So before your next operation, ask yourself, have you already done this case 50 times in your mind. If you found this video helpful, subscribe for more content on surgical performance and training, and share below. Do you already use cognitive simulation in your surgical practice? I would love to hear your experience.